Arhan Kalra is a 12-year-old boy from northern part of India, and he came to us for kidney transplant. Arhan had already undergone a first kidney transplant 6 years back, and because that kidney failed, he had come to us for a kidney transplant now. The main challenges in Arhan's kidney transplant is because அவருக்கு வந்து venous access பெரிய ரத்த குழாய்கள் சொல்லுவோம் kidney transplant பண்றதுக்கு அந்த ரத்த குழாய்களிலே ஒரு பெரிய கிளாட்ஸ் இருந்ததுனாலும் அது சரியா வளராதனாலையும் we had major problems both in giving him dialysis or adequate ஒரு dialysis before transplant கொடுக்கறதுலயும் நிறைய challenges இருந்தது and also ஒரு kidney transplant அந்த கிட்னியை வைக்கிற இடத்துல எந்த நரம்பு குழாயில அந்த சேர்க்கலாம்ன்றதுலயும் there was a lot of challenges with Arhan. But we were able to successfully do it because we had an expert team with intervention radiologist Dr. Ram, who helped us with securing a dialysis access, and also the expertise of Dr. Anil Vaidya is why they were here primarily, because we could do a complicated second kidney transplant in a child with almost absent abdominal veins. And now we have successfully done it, and Arhan is doing very well, and he has got normal kidney function. Post-operatively, Arhan is doing very well. He was in the hospital for around 10 to 12 days, and now he is perfectly fine with good kidney function. He has got good urine output. He's able to regain almost all his normal activities. He can eat normal food now, and he's able to consume good amount of water. And he's also slowly planning to go to school in the next 3 or 4 months.
What is the message you want to give to
the main message that we want to tell all of you is that kidney transplant in children, especially very young children, is no longer a very rare thing. It should be attempted. குழந்தைங்க ரொம்ப சின்ன குழந்தைங்களா இருக்காங்கன்னு சொல்லி கிட்னி டிரான்ஸ்பிளான்ட் அவங்களுக்கு ஒரு ஆப்ஷனா கொடுக்காம இருக்கக்கூடாது. It affects their overall growth, it affects their mental health, it affects their final height, it affects their performance in life itself. So kidney transplant is the best option for children of all age groups. Less than 10 kilos if we should attempt kidney transplant because it is much better treatment than dialysis, than staying on dialysis. So that is the main message here, and it's doable even in complicated patients like Arhan. Still, with a team like us, with a multidisciplinary team, it is always a possibility, and every child should have this opportunity at a normal life, even if they have kidney failure.
How long you take this procedure?
The procedure took us almost close to 8 to 9 hours because of its scale. Normal transplant would take around 3 to 4 hours in a child. But because Arhan's vascular anatomy is so complex and it's a second transplant, it took us close to 8 to 9 hours to complete the surgery and get the best outcomes.
Thank you. Thank you. Thank you.
So Arhan was the first time when his primary kidneys failed. He was a very young child. That time, especially in the time the expertise to do small baby transplant. So he was only around a year or something like that. So the weight. So normally, world over, the standard for doing kidney transplant is at least a child 10 kgs cross பண்ணாதான் ஒரு adult kidney வயிற்றில் வைக்க முடியும். ஸோ அதனால ஒரு 10 kgங்கிறது ஒரு ஸ்டாண்டர்டாகவே இருந்துட்டு இருந்தது. பட் ரீசெண்ட் டைம்ஸில் எஸ்பெஷலி வித் எக்ஸ்பர்ட்ஸ் லைக் டாக்டர் அனில் வைத்யா, they are now able to do for many children who are less than 10 kilos. Unfortunately, when Arhan had kidney failure, அந்த ஆப்ஷன் அந்த எக்ஸ்பர்டைஸ் அப்போ இல்லை. Currently we have. If Arhan were to be a 2-year-old child now we would have offered him a transplant very quickly without him even going on dialysis. டைரக்டாகவே டிரான்ஸ்பிளான்ட் பண்ணக்கூடிய எக்ஸ்பர்டைஸ் இப்போ இருக்குது. அப்போ இல்லாததுனால especially even dialysis, அந்த சின்ன குழந்தைங்களுக்கு dialysis itself was a problem in those years, few years back, especially even in centers which are prominent centers in north and south. Even then dialysis was a problem. Now the expertise has increased, especially surgical expertise has increased so much, especially with Dr. Anil Vaidya coming and operating on here. It has been a very fortunate thing for many kids, not only him. We have also done many small baby transplants for almost 5 to 6 kids. Now we have done small baby transplants with less than 10 kilos. Now currently one should not be on dialysis. Kids even before they need dialysis, we can do a transplant that is called preemptive transplant. Regardless of their weight, we need not wait for them to reach 10 kilos. We can do it much earlier.
What is the post-operative? precaution you should take post-operative?
Post-operative precautions for any transplant. So transplant you receive an organ from a related donor or from a deceased donor. மூளை சாவு ஏற்பட்டவங்க donate பண்ணா. So Arhan this time had a deceased donor transplant. So எதுவா இருந்தாலும் அந்த organ it is considered as a foreign organ. It is not உங்களோட self கிடையாது. Exact matchங்கிறது எப்பவுமே கிடைக்காது unless you are an identical twin. So the body always tries to reject that organ. Even though you surgical or the vella place pannirungalum. So you need lot of medications to make the body accept the organ. So the immunosuppressive medications and so on. So one has to be on lifelong immunosuppressive medications after any transplant, not only kidney transplant, any organ transplant. So and the organ transplant survive that medicines are very important. The medicines or the side effects, one of the main side effects is also having increased risk of infections. So on the medicines immunity கம்மி பண்றதுனால தான் organ accept பண்ண முடியல. So the side effect you'll have increased risk of infection. So that is a very important complication. So we advise patients to be ரொம்ப sterile, hand hygiene நிறைய practice பண்ணணும். Home cooked food சாப்பிடணும், not crowded places க்கு போக கூடாது. Basically very disciplined lifestyle along with caution with extreme precautions to avoid infections is what is the foremost advice that we give. We also advise them to have a good healthy intake of water to maintain the kidney blood supply. So good intake of water and also take the medications at the correct time. There is a risk of organ rejection. You can reject the new organ. So the medications or the timing, medications or dose, all these are very particular. So these are some of the very important complications. We advise the patients, we counsel them both prior to transplant and also in the hospital and post-transplant. We counsel them to avoid all these complications. We also keep monitoring them very closely. Immediate post-transplant, frequent monitor. We give some gap and we monitor, but we always keep them under follow-up and monitor.
Done it, and Arhan is doing very well, and he has got normal kidney function.
Post-operative.
Post-operatively, Arhan is doing very well. He was in the hospital for